ઓલ્ટરનેટિવ મેડિસિન. જ્યારે તમે ઓલ્ટરનેટિવ મેડિસિન શીખો, હું તો શીખેલી છું એટલે મને ખબર છે, ઓલ્ટરનેટિવ મેડિસિન જ્યારે શીખો ત્યારે તમને પોઝિટિવિટી તમારે સમજ પડશે. ઓલ્ટરનેટિવ મેડિસિન યુ લર્ન લોટ ઓફ થિંગ્સ અબાઉટ પોઝિટિવિટી. So when you learn, and as a nurse, you must learn these alternative medicines. I won't go much in details about it. You will learn it later. And the last one is professionalism. Why professionalism is important in the life of a nurse? Why is professionalism so important for us? અમે તમને યુનિફોર્મ પહેરીને હોસ્પિટલમાં મોકલીએ છીએ. અમે કહી શકીએ ને જીન્સ પહેરીને જાને એમાં શું થઈ ગયું? નો. તમારો યુનિફોર્મ તમારી ઓળખ છે કે હું વાઇબ્રન્ટ કોલેજ ઓફ નર્સિંગની છું. તો પ્રોફેશનલિઝમમાં તમારા ટીચર કે બૂટ બરાબર હોવા જોઈએ, કપડા ઇસ્ત્રી કરેલા હોવા જોઈએ, ચોળાયેલા હોવા જોઈએ નહીં. So that is professionalism. The way you walk, the way you talk, the way you write, the way you understand. This is all professionalism. સ્ટુડન્ટ શું કરે? બે જણા હાથ પકડીને ચાલે. એ પ્રોફેશનલિઝમ નથી. કે હાથ છોકરા છોકરી હોય તો છોકરાઓ પણ હોય તો હાથ પકડી લઈએ આમ ચાલ જઈએ આપણે. No, that is not professionalism. અમે કેમ તમને કહીએ માથામાં અંબોડો પહેરો, નેટ લગાવો, મોઢું બરાબર સાફ હોવું જોઈએ, તેલ વધારે નહીં જોવે. પહેલાના જમાના અમે જ્યારે નર્સિંગ કર્યું, when we did nursing, that time madam will agree with me that we were not allowed to wear earrings, no bangles, nothing. We were like simple વિધવા જેવા હતા અમે. You agree with me, madam? We were not allowed to wear earrings also, SNDT. We never wore. कुछ भी नहीं, no lipstick नहीं, bindi, no kajal also, no eyeliner, nothing. Times have changed now. Now तो lipstick भी लगा देते हैं. So this is the, see how the professionalism is changing. Okay, so that is what you say is soft skills. Next slide. Okay, there are top 10 skills nursing students need to succeed. તમારે માટે કયા સ્કિલ્સ હોવા જોઈએ, તમને આવડવા જોઈએ ને તમારે રોજના યુઝ કરવા. પહેલું છે કોન્ફિડન્સ. Why do you want to be confident? એક છોકરીને કહીએ ચાલ અહીંયા ઊભી રહીને બોલ, એ મારાથી નહીં બોલાય. Or if I tell a student tomorrow you have a presentation, what will happen? She will remain absent. Confidence level is not there, so she will remain absent. She won't come. Practice teaching is there tomorrow, she will remain absent. So confidence is one very important for a nursing students to develop. Why and how do we develop confidence? That is through your communication skills. You develop your communication skills through being a linguist. Linguist એટલે શું? અલગ અલગ ભાષા શીખો તમે. When you came for in the first year, the teacher was teaching in English. શું બોલે છે કઈ સમજ નથી પડતી. સાચી વાત? એનાટમી શીખ્યા, કઈ સમજ નથી પડતી. ફંડામેન્ટલ્સ કયા કઈ સમજ નથી પડતી. સાચી વાત કે નહીં? This is where now you are in 4th year and you are in 2nd year and you are in the 1st semester of masters, so you understand it better. But when you were in the 1st year, no. So this is where you develop your confidence with your communication. So I am going together. Communication and confidence, they plays a very important role in our life. Even to talk to your own parents, you don't have confidence. મમ્મી સાથે બોલી શકો, પણ પપ્પા સાથે નહીં બોલી શકો. So confidence is very important in your life. And the second one is ability to connect. કેવી રીતે એબિલિટી કનેક્ટ કરો? તમે ફોન પર વાત કરો છો, હેલો કોણ છે? આ એબિલિટી છે ના. So this is where you need to develop your ability to stand in front of the stage to talk to 2,000, 3,000, 4,000 people ગભરાયા વગર. તમને એક અનુભવ આપું મારો. I am a community health nurse and I worked in the rural areas of Maharashtra. એકદમ ગામડાની અંદર ગામડામાં અમે કામ કરતા, વિદ્યાર્થીઓને લઈને 1-1 મહિનો રહેતી એ લોકોની સાથે. તો જ્યારે હું ગઈ તો ત્યાંના ગ્રામ પંચાયત હતા, પંચાયત સમિતિના લોકો હતા. તો પહેલો શબ્દ એ લોકોનો શું? તમે મરાઠી? ના, તો બોલવાનું બંધ જ કરી દે મારી સાથે. Same thing happened with me. Confidence level, હું ટીચર હતી. I was a teacher and I lost my confidence. What I did, I got some very good friends, Marathi friends, and I started learning with them. I started interacting. Today I have become fluent in the language of Marathi. આજે હું ગુજરાતમાં છું, 10 મહિના થયા ગુજરાતમાં કામ કરી રહેલી છું. મારું ગુજરાતી, હું ગુજરાતી પોતે છું. But my language was not very good in Gujarati. I couldn't read the governmental letter because it was very high Gujarati. હું કોઈ વાર કોઈ પ્રિન્સિપલ ને મળવા જાઉં ને એ ગુજરાતીમાં હાઈ ગુજરાતી બોલે, મારે એમને કેવું પડે, સાહેબ જરા શબ્દનો મીનિંગ શું છે મને જરા કહેજો ને. તો કેમ મેડમ તમને નથી આવડતું? તો સાહેબ હું અહીંયાની છું ને મને ગુજરાતી શીખી નથી હું. ઓકે, કાંઈ વાંધો નહીં. So this is where you develop your ability, confidence, communication. Okay, so this is your ability of understanding. Again, it's come leadership, but remember nursing students, for nursing students, it's a lifelong learning. Nursing and soft skills. See, olden days, we never learned what was soft skills. We never learned what was soft skill. Now this new word of soft skill has come. So soft skills is a long time learning for all of us. તમે ફર્સ્ટ યર નું જે શીખેલા છો તે ફર્સ્ટ યર નું ભૂલી નહીં જવાનું. એ સેકન્ડ યર માં પણ રેખો, સેકન્ડ યર નું પણ નહીં ભૂલવાનું, થર્ડ યર નું ને ફોર્થ યર નું પણ નહીં. So it's a lifelong learning. Soft skills is lifelong learning. What I learned in 1975 till today I remember. હવેના બચ્ચાઓ ખબર નથી, ભૂલી ગઈ હું. બેડ મેકિંગ ભૂલી ગઈ, માઉથવોશ ભૂલી ગઈ. No. So this is, nursing is a lifelong learning. Think like a nurse and work well with colleagues. Why you want to think like a nurse? You think like a nurse is who nurse who? શરમ છે ની નર્સની. નર્સ બનીને કઈ શરમ છે નહીં રાખવાની આપણે. એટલે આપણે આપણું જે વ્યવસાય છે તેનો ગર્વ બતાવો કે હું છું નર્સ. કોઈ પણ મને પૂછે હા હું નર્સ છું, પણ હવે નર્સ એડ્યુકેટર બની ગઈ છું. એવું નથી કે નર્સ છો એટલે ખાલી ટીચિંગમાં જ જવાનું. નર્સ છો તો હોસ્પિટલમાં પણ કામ કરવાનું. અમે પણ કામ કર્યું છે ને પછી ટીચિંગમાં આવ્યા છે. Why you want to work in a hospital? You have to gain the experience to teach your students. That is why you need to work in a hospital. Remember that when you are a nurse, when you finish your 4 years, first work in a hospital and then go for teaching. Why? Because students will ask you, Madam, આ શું છે? તો તમે કહેશો મોદીને લઈ આવો. એટલે તમે હોસ્પિટલમાં જાઓ, તમે અલગ અલગ દર્દીને મળો તો તમને સ્ટુડન્ટને પણ શીખવા માટે મળે અને ત્યાર પછી તમારે તમારા કલીગની સાથે કેવી રીતે ટીમ વર્ક કરો ઇઝ ઓલ્સો ઇમ્પોર્ટન્ટ. ટીમ બિલ્ડિંગ, તમારા ક્લાસમેટની સાથે કેવી રીતે તમે વ્યવહાર કરો છો એ પણ બહુ જરૂરી છે. એઝ અ નોટ ઓનલી ક્લાસમેટ્સ, યોર ફ્રેન્ડ હોય, તમે રસ્તામાં ચાલતા હોય, કોઈ ગમે તેમ બોલે તો તમારે એમની સાથે ગમે તેમ નહીં બોલવું. Why are soft skills crucial in nursing? શું કરવા જરૂરી છે? કોમ્યુનિકેશન છે, યોર ટીમ બિલ્ડિંગ છે, ક્રિટિકલ થિંકિંગ છે, કોન્ફિડન્સ છે, લીડરશિપ ક્વોલિટીઝ છે. ઓલ ધીસ વી ગ્રૂમ યુ. We groom you as to become a nurse. That is why it is crucial. Why is it important that nurses have soft skills? પ્રેમ ભાવ કેમ હોવો જોઈએ? પેશન્ટની સાથે પ્રેમ ભાવ કેમ રાખવાનો? પ્રેમ ભાવ એટલે એમ નહીં કે ચાલ મારી સાથે ચાલ ને આપણે લગ્ન કરી નાખીએ. નો, એ ક્રુશિયલ નથી. પણ પેશન્ટની સાથે તમે કેટલા કમ્પેશનેટ છો? હાઉ મચ કમ્પેશનેટ યુ આર with the patient. That is very important. I'll share one example. I was a second year student and I had a patient who was admitted for polycystectomy. I took care of, I gave him very nice care. આજે પણ એ માણસનું નામ પણ યાદ છે મને. તો હું એના ગામ ગયેલી હતી ફરવા માટે. એ માણસ બેંકમાં કામ કરતો હતો. તો હું જ્યારે એ વખતે ટ્રાવેલર્સ ચેક્સ હતા તો એ એટીએમ નહોતું એ વખતે. તો આઈ વેન્ટ ટુ હિમ ઇન ધ બેંક. એ માણસ બેઠેલો ત્યાં, એને મને જોઈ તરત કીધું તમે આ છો, તમે આ હોસ્પિટલમાં કામ કરેલું, તમે મને ટેક કેર કરેલી, આ કરેલું તે કરેલું, બધું હિસ્ટ્રી કહી દીધી એને મને. તરત હું એને ઓળખી ગઈ. So this is what your patient should remember you lifelong. કે હા પેલી નર્સ હતી ને હોસ્પિટલમાં, મને બહુ સારી સારવાર કરી એને. That is soft skill. Next slide. Why is it important that nurses have soft skills? Next slide, look. Next slide. Okay, next slide. અને આની અંદર તમે નર્સિંગ સોફ્ટ સ્કિલ્સ નર્સિંગ કરિક્યુલમમાં પણ અમે હવે સોફ્ટ સ્કિલ્સ શીખવાના છીએ. નવા સેમિસ્ટર અમે ઇન્ડિયન નર્સિંગ કાઉન્સિલનું જે નવું સેમિસ્ટર આવ્યું છે, નવા સેમિસ્ટર, એમાં પણ અમે શીખાવીશું એમને. હું તો ઓલરેડી એ લોકોને, મારા સ્ટુડન્ટ નવા સ્ટુડન્ટ છે, મારી નવી કોલેજ છે, પણ એમને સોફ્ટ સ્કિલ શીખાવું છું. એમને ખબર નથી આ સોફ્ટ સ્કિલ છે, પણ હું એ લોકોને સોફ્ટ સ્કિલ્સ શીખાવું છું. એટલે આની અંદર પણ તમારે કમ્યુનિકેશન એટીટ્યુડ ઇઝ વેરી ઇમ્પોર્ટન્ટ. એટીટ્યુડ એટલે શું? એક સ્ટુડન્ટે મને ફોન કર્યો, મેડમ મને આમ થાય છે, તબિયત સારી નથી. તો હજુ તો બોલું એટલે ભાર દે કે ફોન નીચે મૂકી દીધો. ઓનલાઈન પણ આપણી સાથે ઘણા જોડાયેલા છે, તો પ્રોબ્લેમ 5 મિનિટ are you fast finish? ગુજરાતી લેંગ્વેજમાં પ્રોબ્લેમ થાય છે. કોને? જે ઓનલાઈન પણ ચાલે છે. Okay, sorry, I'll stop that. Okay, so this is one thing is attitude. When you talk on the phone with somebody, you cannot straight away put off the phone. You have to continue, say thank you and put the phone down. That is what is attitude. Respect for your teachers, respect for your patients is also very important. So that is why attitude for nurses is important. When we talk about networking and teamwork, I've already mentioned to you about teamwork. When a teacher gives you assignment, student is working the rest of the. So teamwork is to work together, not to work individually, but it is always together to work as a teamwork, networking. Networking is you work with different organizations. That is what we call it as networking. When we talk about empathy, what is empathy? There are two words, empathy and sympathy. Sympathy is poor thing, so sad. So student will come to a teacher and she will say, I have this problem. Teacher will say, no, I don't believe you. So that is empathy. This is what a nurse should be. Not, she should be sympathetic, but she also has to be empathetic. Conflict management also is very important. How management? There is a fight between two students, or there is a student who has a difference of opinion with another student. Teacher, student, difference of opinion. Two students will come, madam, that student is doing like this. So she will think, yes, it is true. But actually that may not be true. So that is why conflict management also is very important soft skills in life. And adaptability and irritability. Adaptability. Adaptability, adjustment. Adjusting to the environment. Coming to a college first time in nursing, students don't get adjusted to the environment of a college. So this is the role a teacher plays, how she is going to make the child adapt to that environment. So adaptability is also important for a student and for the teacher. I'll share another example. Recently, I had a student who came to me. She was from far off place in Gujarat. I don't want to stay here. I don't like over here. I had to counsel her. And now she's still there. There was one more student who also came. Every day she would go home and cry and tell the mother, I don't want to go to college. Today the student is still there because we have counseled and she has adjusted to the environment. Next slide. Yes. Why are soft skills in nursing? Are soft skills part of the standards of nursing? Yes. Soft skill is a standard of nursing. As I earlier mentioned to you, uniform is a standard in nursing. We cannot say no need of uniform. So soft skills are also a standard of nursing. Next slide. There are 7 major skills for nursing students. And I would like to share is the growth mindset and openness to feedback. Why you need to grow? Why a student needs to grow? Now you have seen in the first year you have foundations, you have anatomy and physiology, 2 main subjects. Second year you go medical surgical nursing. Third year you go pediatric and psychiatry. Fourth year you have deliveries. So you are growing as a student. You are developing your matureness. You are become a mature individual. Your parents start seeing you as a different person. My daughter is looking different. My daughter's thinking is different. So that is very important for a child or for a nursing student to grow. And in the law is feedback. Why do we ask for a feedback? When you go to hospital and come back, your madam will call you and ask you, how was your posting? Did you learn anything? What did you learn? That is feedback. So you have to give a full feedback to your principal and to your classmates. Sometimes it will be a report written by you. So feedback is very important from the higher ups to you. So nursing students must develop the attitude of reporting. We ask you to write a daily diary. Yes or no? You write daily diary. Why are we making you write daily diary? Because we know what you're doing. So that is the feedback which we get. Now the new rule has come, even teachers also have to write daily diary. Principal also has to write a daily diary. She has to report to her higher ups. So that is where you develop the growth in you. You understand, yes, yesterday what I did, I know this is what this much work is pending for me. So that is why growth is important. And active listening. Why active listening is important for a nurse? A patient is talking to you and you walk away. A patient is talking to you and you get a call and you start talking and patient is watching you. Can you do that? No. Your active listening is for you. Your patient is more important than your relative giving you a call on your mobile. We do not allow our students to use mobile while they are working in the hospital. So active listening, there may be something very important from the patient to tell you. Patient may be wanting to tell you something important which he cannot talk to the doctor. So you have to be a very good listener. When you listen, you get all the information and you are the right person to report to the doctor what information patient is giving to you. And this is confidentiality. You have to be confidentiality. You have to have confidentiality between the patient, doctor, and yourself. So this is your active listening of a nurse. Work ethics. Very important is work ethics. What is work ethics? Your patient is lying on the bed and you go and sit on the bed. Is that work ethics? No. You have to give your medicine to the patient at 10 o'clock and you give him at 12 o'clock. Is that work ethics? No. You have to give a sponge bath and you don't give. You tell the relative, give bath. Is it work ethics? No. So these are certain skills which nursing students must develop to achieve a good nursing career. Next slide. Major hard skills for nursing. What are these hard skills for nursing? Now, you have to be important hard skills for nursing are urgent care and emergency care. Patient has come to the ward and you start talking to somebody on the phone and patient is dying. Is that a skill? No. Our time we never had mobiles, no phones, nothing. So patient came and we had to first take care of the critical patient. So that is very important as a hard skill. Checking and monitoring vital signs. What is happening? Checking and monitoring vital signs. Sometimes students, what they do? They will put round everywhere. Patient has got temperature, but they will not check. Doctor will come and say, sister, patient is having temperature. And sister will say, no, I took temperature, the patient did not have temperature. That is not work ethics. So taking vital signs at the right time is very important. Also is that patient safety and family education. How are we teaching you patient safety? Every hospital has a bed which has railings. Government hospitals have got those mobilized ones. Private hospitals have got the different type of railings which you can hold and close them. Closing them is very important. Why? Patient safety is important because if patient falls, you are in trouble with medical legal case. So that is why nurse has to take care of a delirious patient who will fall down. For her, watching the patient is very important. I'll share one example. Once, one of my students was admitted in the hospital and I went to see her in the hospital. IV was already over. Air was going in through the tubing. There was only one nurse with 75 patients. I went and told her sister, her IV fluid is over. It's okay, she said, doesn't matter, no problem. And she was busy writing some records in the file. Now, I cannot tell her who I am. I did not disclose my name or my designation. But I knew what I had to do, so I closed it down. This nurse, what she said, that is not important. My report is more important than the IV fluid. Is that worth ethics? No. So I can understand that many hospitals and nurses, nursing manpower is less. But when a patient is critical, the nurse has to take care of the patient. Then we have technology skills. Madam Nirja Sood has already mentioned about technology skills. Yes, in our country, we do not have many technologies which are there abroad. Abroad, patient is lying down, there are many machines, you keep pressing, vital sign is seen, ECG is seen, electrolytes is seen, all blood reports, everything, just pressing and you get to see all the reports, which we do not have. So this technology is still not there in our country. Maybe in some parts of the country, in India, maybe there. I am not aware of. But technological skills, when you start working in major hospitals, you will get to learn these new technologies of skills. Communication, I have already mentioned. Critical thinking and problem solving. Yes, this is where we nurses play an important role in critical thinking and problem solving, our nursing care plan. Many nurses do not like nursing care plan. They don't want to use nursing care. Why should I use this? It is waste of time and energy. But no, this is a learning for the student also. Many of the hospitals where I have worked, we had our nurses used, staff nurses used the nursing care plan. So critical thinking and problem solving through nursing care plan is important. And the last one which I am mentioning this is time management. Time management for a nurse is important. She may have to work for 1 hour extra. She has to wait. She has to be on time at the hospital. 7 o'clock means she has to be there at 6:30 in the hospital. By the time she wears her uniform, by the time she walks to the ward, it will take her 10-15 minutes. So time management for a nurse is important. Very particular, you must be very particular with time management. Assignments, submitting your assignments on time, time management. Going to hospital, time management. Coming to college for classes, time management. So these are some of the hard skills for nurses. Next slide. Yes. And what are the soft skills that healthcare professionals should have? I've already mentioned about, but there is one very important aspect I would like to say is flexibility. Why should we nurses be flexible? Whether you are working in a critical care unit or you are working in the hospital or you are working in the college. Flexibility in life is very important. You cannot become rigid in life. There are many things in life which you need to be flexible. Many times my teachers tell me, Madam, you are very flexible. Yes, somewhere I am flexible, somewhere I am rigid also. Somewhere I expect you to do that work, you have to do it. So that is where flexibility is important. Next slide. Yes. There are soft skills in healthcare, I have already mentioned. Yes. There are 5 keys to communication skills and critical in the healthcare field. Now, what are these 5 skills in communication? First one I have already mentioned is listening. Second one important is responsibility. Responsibility and accountability in work. Reporting to work is your responsibility. Accountability to your patient care. Accountability to giving medicines, injection. Accountability to nursing care. That is your responsibility for patient care. And the third one is you need to be honest. A nurse needs to be honest and sincere. If you cannot be honest and sincere, you are not serving your patient. You are not giving good nursing care to your patient honestly. And you have to be objectively, you should be working, not subjectively. Next slide. Why is knowledge and skill important in nursing? Madam has earlier already mentioned about knowledge. A nurse should exploring her knowledge and explore. She cannot sit with only nursing. We have books in our library where we use different type of books where we want to improve the personality of the student. We always inculcate the habit that students must learn, read different type of books, whether they are spiritual or whether they are also informative, whether they are also motivating is very important. So that is why you need to have knowledge and skill. Nurse cannot sit only with nursing. Nursing, not only nursing, you must have knowledge in all aspects of life. Next slide. Yes. How to improve your skills for nursing is your continue your education. Your principal is your inspiration. She has gone a long way in her life. That is where you learn. You learn your inspiration from your own people, from your own college. You understand. This is how your skill will improve is your you're improving in your further education. Exploring advanced nursing education, learn how effectively you can communicate. If you cannot speak the language, you develop the learning of that language. You develop asking people how to talk. You can read books and the books will give you an answer. Join a professional organization. Nowadays we have WhatsApp groups coming up. And these WhatsApp groups also you can learn through these organizations. So joining through nursing organizations and commitment to service and knowledge. Commitment is again very important in life. You have to be committed to your organization. As I earlier said, honesty, sincerity, dedication, devotion. This is your commitment to the profession of nursing. Next slide. Yes. Effective communication skills. Written, Madam has already mentioned. Madam has already mentioned about verbal, non-verbal communication, presentation skills, patient education, compassionate. As a nurse, your skill should be compassionate. Your cultural awareness. What type of a patient is coming from what background is also very important. Personal connections, your knowledge of patient's connections and your patient's relatives connection. Trust. Patient trusting a nurse. Patient trusting a hospital. Patient trusting an organization. Student trusting an organization. Student trusting a college. Which college should I decide where I should go for higher education? Trust. And verbal and active listening. Next slide. Next slide. Go ahead. Next slide. Top soft skills for nursing, I've already mentioned, but these are the four main top Communication, teamwork, problem solving, and leadership. Next slide. Next slide. Next slide. Yes. This is the difference you see between hard skill and soft skills. You have hard skills is proficiency in any language. You can learn any language. So your proficiency in a language, a degree or a certificate is a hard skill. Typing speed is a hard skill. Machine operation, computers is a hard skill, and computer programming is a hard skill. Then when we talk about soft skills, that is communication, flexibility, leadership, teamwork, and time management. Next slide. Go to the next, last. Bus. Soft skills for teachers. Very important. And how many teachers are here? I know Sonal Beni is there and Christina. Anybody, any other teachers? Only 2 teachers? 3 of any of them. I'm also there with you. Okay. So now what teachers have to have soft skills is learning. Before going to teach a patient, a student, he has to do plenty of learning. Nowadays, we cannot underestimate our students because the Google is always ready. They will open the Google and see. So learning is important. Experience. I mentioned to you, after you finish your 4 years, after you finish your master's, go and work in the clinical area and then go for teaching. That is, your experience is going to help you in teaching. Ability to teach. Your ability to teach also will come with your experience. Your growth will come. Your training will competency in teaching your students in knowledge is also going to help you. So these aspects of teaching, soft skills for a teacher is very important. So see, all of them, they are all hand in hand. Learning, experience, ability, growth, training, and competency, knowledge. These are all soft skills for teachers. Okay, thank you.
Please stay on the stage, Parul ma'am. I would like to invite Dr. Alka Tajne ma'am to give memento and certificate to Parul Kibliwala ma'am as a token of appreciation. I would like to call upon a stage Mr. Hitesh Bhai Nasik sir to give memento and certification to the Alka Tajne ma'am. Honor to introduce our next moderator, Dr. Mohammad Hussain sir, Vice Principal of Gokhale Nursing College, Nasik, and Vice President of Maharashtra Chapter of Nursing Scholars Society. I would like to welcome Dr. Mohammad Hussain sir to direct the further session.
Good afternoon to all. So for today's next session, we have with us Professor Himanshu Trivedi. He is a principal in Shantiniketan College of Nursing. If you see the academic qualification of him, he has completed his master's and he has worked as a staff nurse, lecturer, associate professor, vice principal and principal. Now rightly he is working as a principal. And his professional membership is to various bodies like TNAI, NSS, NHS, NTAI, and sir has published 2 books, research, nursing research, and he is a publisher and he's written some articles also. He was awarded, he was nominated for some awards also. So for today's section, I welcome Himanshu Trivedi sir. And now I request, please come and proceed with the session.
Thank you. Very good afternoon to everyone. As it is, my topic is interactive teaching strategies. Okay, it will be really helpful for the teachers and as well as for the future teacher also. So I stand here because I want some interactions with many members. So can you mean the interaction first? Anyone? Yeah, please.
Thank you, sir, for the question. Interaction between means communication, just like teacher and student. That is known as an interaction. Thank you, sir.
I'll give you one chocolate for that. Thank you. Just rewarding that one, that you at least you said the interaction. Very good. That is what? As a teacher, we must capability, we must have an ability, the skill that how the teacher must teach the students. And that only I'm going to teach you here. And that only I'm going to teach the teachers also, that how they must teach the students. Since morning, we have skilled many things like concept mappings, impacts on nursing knowledge, nursing educations, regarding the technology. Madam has taken the soft skills, communication, very important role of communication in the teaching. Why? Because when we teach the students, if you don't know about the students, we cannot teach them. So communications always we are doing with the patients, but with the students also, it's really important to have a communication with the students. Agree? Thank you. So we'll start the topic with the interaction, interactive teaching strategies. Please, sir, next. We think of the effective teachers. Always we think the effective teachers we had over the years with the sense of recognition. But those who have touched our humanity, remember with the deep sense of gratitude. हम उनको ही पहचानते हैं जिन्होंने हमारी सेंस ऑफ ग्रेटिट्यूड को पहचाना है, हमको टच किया है, हम उन्हीं टीचर को पहचानते हैं. So that is what, that ability, being a teacher, you should always create. You must create that one. Okay, next please. You're not tired, no? You're not tired? પાછળ થોડા મોબાઈલ મથરે છે. Please. We think too much about effective methods of teaching and not enough about the effective interactive methods of learning. Effective teaching કરી છે, but effective interactive methods કયા કયા હોવા જોઈએ? What are interactive effective methods must be there? And that only we are going to see here. Yes, next. Before going to the main topic, we'll see some analysis of traditional things. What could be the analysis? Previously, what happens? And now what you will change the world. Pre-technology education context, the teacher is the sender or the source. Previously, teacher only source to study the things. But today, there are many methods of learning. There are many methods of teaching as well as the learning. The educational material is the information or the message. Information material. It was just a message to the students. The student is the receiver of the information. You are agreeing? Yes. You are agreeing that means we are receiver the information. So always on that point only, I'm just bringing you in that we should have an interest ourselves. Till if we are not having an interest on learning, we cannot learn properly. Delivery of medium, chalk and talk method, overhead projector, transparencies. Previously, What happens? Talk and talk method. Teacher used to write here and students to the back of the teachers. And what are they are doing? They don't know. Students, what they are doing, teacher will not be able to know. So that is all traditional methods. Okay. Over a transparency, whether it may be readable or not readable, hurry-burry they are writing. Okay. So interactions is not there. Just they teach the students. Okay. But interaction, nowadays, students require the interactions for that. If you are interacting with the student so that you can check the student's level of understanding. Okay. In such a lecture, student assume a purely passive role and their concentration fed up after 15 to 20 minutes. क्या होता है इसमें? 15 से 20 minute में आपका पूरा concentration down. Okay, you can attend only 15 to 20 minutes of lecture, 45 minutes of lecture, you can learn only 15 to 20 minutes. Is it? Sure? I'm correct now? Huh? See, teachers. See the teachers, your students. Okay. So being a teacher, we should develop the skills under ourselves. Being a teacher, we should develop the skills of innovative learning, interactive learning to the students. Yes, next. Traditional teaching, once again, chalk and talk. How the students used to be and how the teacher used to be. Please. History, earlier teacher was the only source of knowledge, student just acted as a listener, but not now. We cannot bring in acted as a listener, make them interaction. Make them with the interaction. Okay. Why less? Don't talk. I'm taking class, don't talk. Why? Just touch their heart. As a teacher, we should touch the heart of the students. What level of understanding they need, that is only the we required. And traditionally what happens? Shh. Only they do. But I'm not saying previously. Now there is a change. We required a change. Being a teacher, we should require a change in ourselves. Yes. Limitation, teaching in classroom using chalk and talk is one-way flow of informations. Teacher used to write and students also used to write. There is limitation of time also, limitation of resources also, so that we cannot adapt in a current situation, in current scenario. Teacher often continuously talk. We must get the feedback from the students. If without getting a feedback from the students, if we are learning and teaching them, so we are not properly getting with the students. We must, as we are always being a teacher, we are telling the students that we should understand the need of the patient. So why, as a teacher, why don't you? The material. And the textbooks only they require. Not, there are many methods. We'll see all the methods in next slides and all. There is an insufficient interaction with the students in classroom. Whenever classroom teachings is there is a less interaction with the students. Agreeing? Agreeing, everyone? Yes. More emphasis. Not bringing the experience in real time as well as in the practical exposure. Being a teacher, we should teach the students. Since morning, Kapoor Madam has said regarding the concept mapping, we must learn that how, as a teacher, how we can bring the idea of that point, how we can bring the idea of that particular content, how we can present to the students. That is a more and more effectively for the students if you really use the concept mappings and all. Yes. Objectives, we'll see the objectives here, to identify the different learning styles, to explore how interactive teaching strategies. This was the objective. Now the teaching methods, there are many. There are many. Lecture explaining, resource people, teacher must be a resourceful, all the information teacher must have before starting the class. As madam also saying, teacher को तैयारी करने के लिए 6 hours of learning they has to do, and they just pick it in 1 hour. So how much teacher used to learn proper, how they are learning and how they are preparing themselves. Case studies, practical exposure you are bringing in that. Group discussions among the peer group. We must always discuss among the peer, same age group. Brainstorming and buzz groups. Brainstorming activity if we are bringing to the students. Brainstorming activities like some solutions, like, okay, bringing into the problem to the students. We can really make a learning more effective to the students. Field trip, educational visit, educational tours and everything. Like if you want to learn regarding the pasteurizations, what do? We go and learning from the milk dairy. Okay, we used to visit there and we are learning. That is what? Field trip. Okay, we are touring there and we are learning from there. Quiz competitions. In the quiz, we are out of the box, we are thinking. Okay, we are bringing in that books, journal, website reviews, all others methods. Interactive video and audio sessions. Interactive videos. Nowadays, many teachers used to have interactive videos regarding many things like coronary heart diseases. How it's happening? YouTube's video are there. Okay. So how the development occurs? There are many videos are there in the YouTube. We can take that video and we can teach the students. Yes, next. Strategies, direct study. Direct studies also we can do. Role play. Role play is an important topic, important things to learn from the students, to the students, for the students. We can make Socratic dialogue, jigsaw crossword. Nowadays in newspapers also, crosswords are coming. So from that also, we can create ourselves in the nursing education. Crosswords we can create for the medical languages. Concept mapping, morning only madam discuss. Sketch, preparing the sketch of the things. Debates, making many debates in that. Cooperative learning, panel of experts and college. Yes, sir. Next. We'll see one by one everything. Why innovate? The pyramid of learning. One slide. Interactive teaching method. 5%. Participate. Previously already I said that 50% discussions we are bringing in our teaching and in your learning. So it will be more effective, more and more effective to the students as well as for the teachers also. Practice by doing. We are taking them into the demonstration lab. We are taking into the real life situation to the patients. Real life situations, if we are making them to learn properly, they can easily understand the topics. Teach others. Ek bijane banavanu. That is a more and more effective discussion, peer group discussions. So that is a more effective learning method, that this is participatory teaching method. We'll see the Bloom's. Next, sir. Bloom's taxonomy. What is Bloom taxonomy? Regarding the educational things, Bloom's has given many things. Bloom's what he's doing? It's a set of classification. Let us bring it for the nursing process also. Set of classification, 13 domains they are teaching, 247 nursing diagnosis they have got. Same like in education also, the Bloom's has brought this one. This is a old taxonomy. I just revised this old taxonomy: knowledge, comprehension, application, analysis, synthesis, and evaluation. But the revised one, I will go for the revised one. I have bring it here, the revised one. In 2001, it has been released. Yes, sir. Next. Cognitive domain. Based on the cognitive domain, it is remembering, recall specific facts. Recalling the specific facts. घना बधा टीचर्स कहता हसे, बहुत सारे टीचर्स ऐसा बोलते हैं कि भाई तुम जाओ शाम को पढ़ो ताकि आपको याद रहे. Everyday learning always remember in our life. So when we remember everything, we can easily learn. Not the mug-upping. Not the mug-upping. આજે ક્લાસ લીધી, સાંજે વાંચી લો ખાલી. 5 minutes it will take. 5 minutes it will take to read one class. Everything it will recall and remember. This morning also madam said regarding the every 5 days, 10 days, if you bring a practice of that one, it takes only 15 to 20 minutes of the whole day class. 15 to 20 minutes, you can expand after 5 o'clock. So as a students, for the students, if you are bringing this methods, so it will be really effective to the students. Understanding, grasp meaning of instructional material. Understanding, whatever the teachers are taking the classes, as a part of students, we should understand the concept of the class. If we are not understanding the concept, it will not be clear. Applying, whatever you have understood, you apply it. We must apply it in our knowledge with the practice. Analyze, take apart from known and identity relations, we should analyze that one, that how it is going to be. When we are going with the clinicals, anatomy classes are going on, means you might have first year, second year, third year, fourth year, many students are here and many teachers are also here. Anatomy, how the bones are there, how the musculoskeletal systems are there. If we work with the patient, we teach with the patients anatomical features, anatomical positions, everything with the skeletal, we can bring innovative and interactive things with the students. Evaluating, exam information and make judgment. We should evaluate the students also. It is also our role being a teacher that we should bring a judgment for the students, that how the students has learned that one, and again use information to create something new. So this is what the cognitive domain has been used by the Bloom's taxonomy. Yes, sir. Yes, next. First one, role play. Some of the teaching methods I have bring it here, that in a day-to-day life we can utilize in our classroom also. So that what are that one strategies? What are that innovative strategies? What are the interactive strategies for the students to teach them in the classrooms? So one is the role play. We can bring a role play, or the role play everyone knows, no? How we are acting for the one of particular things, and we are teaching the patient as well as the same, like we can teach the students also for bringing up the role play. It is time consuming. I know it is a time consuming, but it is a effective one. Okay. What it is do? Stand, interpersonal skills. See the benefits. Never go for the disadvantage. See the strength, see the advantages. Okay, never go for the disadvantage. Always how it is strengthening the role play. Interactive, interpersonal skill. It develops interpersonal relationship within the teacher and students. When we are talking with the patients and nurse, so interpersonal skills is developed. Communication skills. Mon madam already said, Palul madam, regarding the communication skills. The communication skills also develop in that. Conflict resolutions. Whatever the any complex resolutions are there, we can resolve that one also. Developing insight. We can develop ourselves, inside it will be developed, ourselves we will be developed. And group decision making. We can make a group decisions and decision making capability, decision making attitudes will be developed in ourselves if we bring a such kind of the activity, interactive teaching methods in our day-to-day lifestyles. Yes, excellent. Mind mapping. Next. Innovative way. Mind mapping. Same like concept mapping. Mind mapping activity we can bring to the students. If we bring it like here yellow fruit, red fruits, what are the yellow color fruits? I have bring the yellow color fruits in a yellow picture only. I have bring the red fruits in a red color only. I have the orange color fruits in orange colors only. Mind mapping. We are clearing for the students. Okay. So that is also another innovative way of mind. Maybe making notes with the keywords and images. We can make a notes with the images and visual and sensory tool at our. It will really, when we are attracting something, we can learn something. If we are attracting to the points, we are learn to that one. Recollect information for the repeat karo, it will be recollect. Again and again, your mind will recollect because your cognitive demand has came. Once the cognitive demand has come in your mind, so definitely you will learn the particular things. Yes, sir. Next. Next. See, another pictures I have kept that one for that mind mapping. Health, how diet, exercise, stress, sleep, how we can maintain with that. Next. Field trips, of course. एक एग्जांपल तो दे ही दिया था मैंने अमूल डेयरी का pasteurization techniques if you wants to learn, some educational strategies if you want to learn, or some educational policies or some national policies. We are going at the regulatory bodies, okay, like INC, GNC, whatever the respective bodies you're having. So understanding the policy, we have to go there. So then only we can, that is a field trip. If you have a field trip with that particular topic, then you can learn many things. Since Deepak sir has said in the morning, that many countries have bringing excellent education's level. Like Germany, he said like Germany. I know particularly for the Germany, how they are bringing a primary education to the students. They are taking the students at the particular level and they are making them to learn. And definitely it is going to be learned very easily. If you go at the mall and if you go and pick the tomato, what are the benefits of tomato? If you go and pick the orange, what are the benefits of orange? Like that they are teaching to the primary education. What is that? Field trip to that particular point. The same thing when we are in the nursing, we should have a field trip to we are going to the hospitals, but we are wasting the time. We should learn there. When the patient is there front of us, if we are learning properly with the patients, we have many things to learn with the patients also. So being utilizing field trip method, we can really bring excellence in education, excellency in learning, and excellency in communicating also. Yes. Learning games. Morning also, madam said regarding Sud madam has said regarding the learning games. We can create the games in such a kind way that some puzzles like that for the nursing related subjects like medical, surgical, like pediatry, like community. If we prepare some puzzles like games, snake and ladder. So like that games, if we prepare, we can really understand and students can also understand the things. I have seen your labs here. Just madam has bringing us to the lab. It was really developed. You have used this one. The games have you have created in some community health nursing lab. So it is really an interactive strategies to teach the students. And from that way, the students can learn easily. So what are the strands of learning game? Engage while learning through playing. You can engage the students. Learn social skills like sharing. You can share the idea, share the thought, not the sharing thought. Develop problem solving skills. Problem solving skills we are developing here. Perfect way to channel energy. Hyperactive kids we can channel with the game and all. Yes, sir. Teaching with a good sense of humor. Very good thing. Teacher must understand the topic first. With the sense of humor, if you are making, so what is in that? We must apply to the students. Physically and physiological beneficial, it is there. Sense of humor. The normal things, normal ranges of excellency in learning, we can, if we are bringing to the students, and the concept, if we are clearing to the students, really students will enjoy nicely. Relax students and reduce the stress. It will relax the students and reduce the stress of the students. The topic has not been taught properly to us. The stress students is always having. The topic I did not understand. The topic I couldn't get it properly. I'm not clear with the topics. So many stress the students are having. So being a teacher, we should clear this all the stress of the students. Develop a harmonious relationship between the student, teachers, harmonious relationship with the interpersonal skill relationship with the students we should develop. If we learn and develop these skills to the students, so we can understand the student capability, level of understanding, and we can bring into the information to the students. Yes. Group discussion, it is everywhere known to everyone. Group discussion is very important role in developing the educational strategies and innovative strategies. What happens? I have written the strands only. So what it will develop? Develop a speaking skills. એકબીજા સાથે વાતો કરો, communication. It will develop group discussion માં. એકબીજા સાથે એક problem આના સાથે એક problem આના સાથે બે group માં divide કરીએ. We can develop the skills. We can develop the skill in the group discussion. Brainstorming, the activity must be a brainstorming. Critical thinking development will be created easily. Provide feedback to the students as well as the teacher both. It will provide the feedbacks to the student as well as teacher too, because when the brainstorming activity has been carried out with the students, so really it will be a more interactive things to be happen with the students. So really the group discussion, it will really help for the students to learn in many things. Next, sir. Quiz. Already we have discussed regarding the quiz. We'll see the helps to remember. What are the stands for that? We can help the students to remember the things. Think out of the box. Again, I'm saying, when we have a quiz, when we have a puzzles, like a situation in the classroom, we can really develop and level of understanding of the students we can create nicely. If you are always bringing passive questions, active questions, everything if you are asking to the students, we can really create a interaction with the students. Improve or expanding one's knowledge. Yeah. Another, enables the student to think from differently and just simple, out of the box. We are learning from out of the box, because when we create the puzzles like that, so totally it is out of the box. Snake ladders like that, something else. Many games are preparing for that. Cheats also preparing for that. Okay, I'm bringing this question. What could be the answer? They are preparing the cheats. Okay, they are thinking. Okay, what could be the answer? Let's see. So they are bringing, they were at least read that one, the level of understanding we can create again in that. Next, sir. Set-way approach. Very nice it is. Good for the teachers to make the students to be clear with the concept. Next. Bring it down. This approach attempts to explain the application. You should always clear the concept of the student that what topics you are going to discuss with the student. That is Z to A approach. A to Z not. Return back. Z to A approach. Stan makes a particular concept clear. Kaipan, like if we are talking regarding the heart supply, blood supply in the heart, we can clear Z to approach. If we are clearing to the patient or students, it will really develop the interactive skills in the students. Students develop interest to know exactly the concept. Create. What happens in that? Teacher must go with some problem and ask the students to find the solution. Z to A approach. Many students coming with some problems and asking the students to find the solution. So Z to approach concept we are clearing to the students, bringing into the information to the students, bringing them into the problem and ask them to bring solutions for that. Z to A approach. Yes. Blended learning. Since morning we are doing that only, online, offline, everywhere. Blended learning is the term given to the educational practice of combining digital learning tools with the more digital as well as the face-to-face. Nursing Scholars Society has developed that platform here for the blended learning. Those students cannot be able due to the rainy seasons. Many students and many delegates has not been reached here. They are understanding, they are learning from the digitalizations. So blended learning is there. Face-to-face training, virtual classroom, webinar, link, simulation, assessment, one-on-one coachings to the students. So blended learning is also important. If you are not understanding many students, we can use the blended learning for that. Yes, sir. Traditional and multimedia learning, traditional methods, one-way flow, previously teacher and students. But now we have to use the multimedia. What we are using here, multimedia, what we are using, what this guys is doing, focusing us, what is doing. They are bringing a multimedia. We are creating an interaction with the students. The students can identify these things. We should also develop these things. A multimedia. Like AVH, we can prepare posters, scripts, many things we can prepare. We can utilize these techniques to the students and really we can learn of experiences much and more. Yes. Innovative methods of teaching. I hear and I forget. What I hear, I forget. I see, I believe. I do, I understand. Accepting? Everyone? Huh? I do, I understand. જ્યાં સુધી હું નહીં કરું, જાતે હું નહીં કરું, ત્યાં સુધી we cannot understand anything. ઘણા બધા બોલીને જતા રહે પણ આપણને કઈ ખ્યાલ જ નહીં આવતું. બધું ઉપર ઉપર. બધું ઉપર ઉપર જાય છે. બરાબર ને? So that is what. Always, that is what I am saying. We should clear our concept and we should mind map, we should do that way approach, we should apply everything. Many strategies are there. We can apply in a day-to-day session. Remembering technique. Since morning we are taking the classes, evening 10 to 15 minutes, give a 10 to 15 minutes. You will remember. You are recalling the things. Bloom's taxonomy, that is only telling. Bloom's taxonomy, that's only telling that you remember the things, you recall the things. Once you recalling every day, it will really. સાંજે જઈને અત્યારે મોબાઈલ જઈને મથરો, Facebook, Insta, everything. We are seeing the notification that we are remembering every day, but we are not remembering the classroom learning. We are remembering. Give time for the classroom learning also. Given a daily habits like Insta and Facebook, like a social media and like that. Bring it in your day-to-day activity, the classroom learning. You should remember, recall everything. You should create opportunity for yourself. You can learn many things. Next. Here, key teaching techniques. I have bring it here, some key teaching techniques. Engage real life situation problem. Engage ourselves in a real life situations. If we are engaging ourselves in understanding many things, we can really learn from that. Variety. Many varieties are there. Role play, assignment, fieldwork, hands-on experience, group discussion, PPT, variety. We can learn from that. Active learning. Many places we can have active learning. Actively we are participating to that part. We are learning that one. Is this person since morning is doing actively participated. He learned since morning, he learned many things in that. Today he's done the research in that. So he learned. Student teaching. Student can teach each other with the material, with the classroom. Think, pair, and share. Think, pair, make a pair of, and share the information. Once we share the informations, once we think, when we make a pair, really we are going to learn properly. And we cannot, no one can stop from that. Review, prior information, student, teacher, peer review. We can have a review of the class. That only evening, go and take a review of the class. It is going to be real. Evaluation of students, learning evaluation of classroom teaching. What is to be taught to us? You think of that one. Feedback, giving critical feedback in order to improve teachers' self-reflection. Give some critical feedback. Teachers are here not abilizing, not utilizing this skill. If we take in our reflections, if we want the reflection, I used to tell many teachers, they are hearing from many social media, Zoom, and those teachers, I asked them, how was my class? I used to ask them, get the reflections. If we get the reflection from the students, then we can improvise ourselves in how to teach the class. We can improvise. So always, as a teacher, we should get the feedback from the students. And once we get the feedback, take it as a positively. Don't take it negatively. Take it as a positively. It will really help it out on the next or third day. You will change. You can see and you can identify the changes in yourself. So these are the key teaching techniques. Yes, sir. Teachers are the greatest innovator. Teachers, we are all teachers. In future, you may nurse educator, you may be a nurse educator, you may be staff nurse, or many teachers are the great innovator. Anyone who stops learning is old, whether at 20 or 80. Anyone who keeps learning, stay young. Legends are here. Legends are here. I'm telling this one. At 20, if we left this one, we are old. If we are continuously learning, morning, Sud Madam has said that digitalization I was not able to, but I learned from that. 80, at the age of 60, 70, 80, they are learning. Why we cannot? Why we cannot? We cannot. We can. To teach is to learn twice. To teach is to learn twice. Teachers should guide without participate without dominating. Important for the teachers here. Teachers should guide without dictating. Another teachers who dictate kare. Okay, write the nursing definition. Nursing is art and science, like that. Dictating. Dominating. You don't know, you sit. You don't know, you sit. Like, don't dominate the students. Bring interaction with the students. Once you bring the interaction with the students, you also will enjoy. Your students also will enjoy on that. The critical factor. Not a class size. That's a facts. the learning, nature of the teaching as it affects the learning. Yes, sir. Learning never ends. Learning can never ends. Hope you enjoy the class. Is it interactive? Really, I don't want the claps. Did you all understood? Especially teachers, those who are going to be a teacher. MSc students are here. Many students on the online also. Many teachers are online. Maybe if you are really utilizing the strategies, you can see the changes in yourself as well as in your students. Also, if you really utilizing the strategies, I used to have these strategies in my classroom. When being a principal, many of them thinking, I'm become principal. Why should I teach the students? Why should I teach the students? Like that they are saying. Nothing is there. If you are a principal, we should teach the students because you are the more experienced than the teacher. You are the more experienced than the teacher. So being a principal, if we are going to the classroom, we can learn many things. We can teach many things to the students. What I specially feel in that. So any questions? Any questions? Is it clear? Okay. Thank you. Thank you so much. Thank you so much.
Thank
you.
you, sir.
Thank you. Thanks to Vibrant Nursing College for inviting me. Thank you, Nursing Scholars Society, for inviting me here as a guest expert teacher. Thank you. Thank you, everyone. Thank you, whole Vibrant team leaders, teachers, administrators, all students, many delegates, principal madam, खास करके हमारे अलका ताकि Thank you. Thank you, Bhunu sir, also. And thank you all the management team.
Thank you, sir. Stay on the stage, sir. I would like to invite Dr. Mohammad Hussain, sir, to give memento to Professor Himanshu Trivedi, sir, as a token of admiration. To invite Dr. Alka Tajne ma'am to give memento to Dr. Mohammad Hussain sir as a token of appreciation. I would like to invite Mr. Bansi Khun sir too. Thank you, sir. Thank you, ma'am. All the delegates are requested to fill the postage form and return it within the 10 minutes to our volunteers. Let us start with the scientific paper presentation. For the scientific paper presentation, our evaluators are Dr. Sudhasi Mohe ma'am, Principal and CEO, Sri Swami Samath College of Nursing, Wardha, and Dr. Mohammad Hussain sir, Vice Principal of Gokhale Nursing College, Nasik, and Vice President of Maharashtra Chapter of Nursing Scholars Society. So let us start with the scientific paper presentation. Okay, our first participation, I would like to give the guidelines for the paper presentation. The time limit of paper presentation is total 20 minutes, 15 minutes for the presentation and 5 minutes for the discussion session. So I request all the participant to please complete your presentation within the 15 minutes. First participant, please be ready. Our first participant for the paper presentation is Dr. Sundari Apte ma'am. And requested next participant, Mrs. Hemawati, to be ready for your presentation. I would like to correct myself. For the presentation, participants have only 10 minutes and 5 minutes will be discussion session.
Hello.
Yes.
Shall I start? Shall I start?
Yes, you can start.
Yeah. Good afternoon, everyone. Thank you for giving me an opportunity to present in this Nursing Scholar Society and Vibrant Nursing College, Surat, and organizing a national conference on educational strategies and challenges. My first statement is, a study to assess the level of psychological well-being and resilience among nursing students post second wave COVID-19 from selected nursing colleges of Pune city. The title is Assess the Psychological Well-being and Resilience among nursing students after the second wave of COVID-19. To introduce, the lifestyle of the student nurse have undergone a drastic change due to the pandemic, as we have learned just now in the last lecture, COVID-19, because we have become more techno-savvy. Face-to-face teaching is replaced by online classes. The demonstration has become lab is converted into virtual videos. Thus, the main question arises is regarding their psychological wellness along with the physical and how well they can rebound back to the college classes. With this view pestering in the mind of mental health faculties more, we decided to conduct a cross-sectional study among the student nurses. The objectives were to assess the level of psychological wellness among the nursing students and to assess the level of resilience among the nursing students from selected nursing institutes of Pune city, and to find the correlation between the psychological wellness and resilience, and to associate the research finding with the selected demographic of variables. With the hypothesis, which was null hypothesis, the first one was there will be no correlation between the psychological well-being and resilience at level of 0.05 level of significance. And the second hypothesis was there will be no association between the research finding and the selected demographical variables. The review of literature was done, 3 national on psychological well-being and 2 in resilience, and correlation was 1, and international 1 each in every section. The research methodology which we adopted was quantitative approach, a descriptive cross-sectional study. The nursing students were the population, and the nursing students from selected institute was my sample. It was purposive sampling, and 201 sample was the number of sample size. The inclusion criteria was students who were about 18 years, and exclusion criteria was A&M and the postgraduate students were not involved. Variables were psychological well-being and resilience level. Settings were selected nursing institute in Pune city. Now the tools was demographic data, which had 7 questionnaire, and drive psychological well-being. The short form 18 question was a self-structure questionnaire, which was divided into 7-point scale on Both negative and positive statements were there and were graded as good, better, and best. Resilience scale for nurses, 21 items on 0.5 scales, which was graded again as good, better, and best. Validity was conducted and it was found, and reliability was 0, R is equal to 0.81 for the resilience, and it was 0.87 for the RIVES, which is a standardized tool. The pilot study was done on 20 samples, which is found to be feasible. The limitation of the study was lack of permission from the other institute because of the COVID. Only one college was included in our study. Analysis of the demographic, it shows that maximum children were in the sample were in the age group of 21 to 23, which was around 50%. The gender was being a female-oriented profession, it was 69%. Professional courses, GNM and BSc both were included, and it was more seen in the BSc second year students were more compared to the BSc fourth years, as compared to GNM also was 41%. Chronic illness, 4 of them were having some chronic illnesses out of 201. That comes to 2%. And having COVID and who were quarantined at home were around 13%. Number of vaccines, 2 doses, 97% has taken. And 52% were from the hostel. So this was about the demographic data. Now, grading of the psychological wellness. The psychological wellness had 3 to 5 questions in each part, and it was divided into self-acceptance, purpose of life, relationship with others, personal growth, and environmental mastery. And it was found that it was all almost in the better state, except for the personal growth and environmental mastery, which was in the best category. The mean and median standard deviation can be seen in the thing. When in case of resilience level of among the nursing students, again it was divided into 5 subsection: positivity in nursing, professionalism, interpersonal skills, having an anchor in personal life, that is a mentor, response to the novelty, and the total score. In the total score, it was found that the resilience level was very good. It was in the best, that was around 71 to 105. And even in all the sub categories also, it was more in the best qualities. That means the samples were having good rebounding tendency to come out from the COVID situation. Now coming to the correlation and association. The correlation between the psychological well-being and resilience was found to be negatively correlated, that is 0.168, and the p-value was minus 0.017. Thus, the null hypothesis is rejected and alternative hypothesis is accepted. And the association between the psychological well-being and resilience with demographic variable showed no association with any of the demographic variable, which means that it has no effect. All the parameters of the demographic has no any effect on the resilience level or the psychological well-being. Thus, we have accepted the null hypothesis and alternative is rejected. Now, coming to the nursing implication and recommendation. In nursing education, we can use a CNE and conduct various programs for resilience, like how to overcome the problems. In nursing administration, when we go and go to the wards and see the people, we can ask them to, tell them the few various levels, various methods of coming out from the problem. In the nursing services, we can talk to the nurses and do the one-to-one counseling, and we can tell them the various means of coming out of the situation. Nursing research, we can do many more researchers. I have seen only 4 or 5 researchers. Nothing is Indian. Indian is around 5 of them. So in a similar study can be done on a larger population, which we are planning to do. We can have an intervention and then see the level of both the parameters after the intervention. We can also add other psychological parameters like anxiety, stress, depression, and conduct the study in a larger population. With this, I conclude my presentation. If any query or any discussion, I'm open to it. Thank you, ma'am. Hello. Hello.
Hello.
Yes, sir.
Hello, presenter Aditya.
Yeah. I can hear you, sir. Hello. Yes, sir.
So overall, your presentation we have seen. So in that review of literature, you have not mentioned even what conceptual framework you utilize for your research was also not there. Even you should tell about your reference citations as example, not all, but as an example, you should show one or two. So your study was descriptive now. Hello.
Hello. Can you hear me, sir? Hello.
It was descriptive now.
Yes, sir. It was descriptive, and we are still collecting samples from many of the students because we just got permission from the various other colleges. And that's why I'm not put my, actually we were planning to do the health promotion model as a conceptual framework.
Study
Sir, I can't hear you.
So can we proceed for the next?
Thank you, Bimla Kapoor, ma'am, for your presence. Thank you so much, ma'am. Next participant for the paper presentation is Mrs. Hemavati, ma'am. Are you ready? Please unmute yourself first.
Yeah, now you able to hear me, ma'am? Able to hear me? 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 Able to They're not able to share the screen. Please activate screen sharing. Share the screen. So I am not able to share the screen. Can you please activate that? Force disabled participants to share the screen. Can you please activate? I am not able to share the screen. Good afternoon, everybody. Thank you for the opportunity. I thank Vibrant College of Nursing and National Nursing Scholars Society for the opportunity given here. So my topic for today's presentation is overweight and obesity among adolescent girls. Myself, Mrs. Hemavati, doing my PhD in Vinayaka Mission Annapurna College of Nursing in the universities in the Salem, Tamil Nadu. So let me move on our presentation. So it is about adolescents are the young people aged between 10 to 19 years, which comprise of 1.2 billion population worldwide. This indicates that roughly 1 in every 6 person is an adolescent. About 21% of Indian population is adolescents. Adolescent forms a healthy group, and the health status of an adolescent affects the health status during their adulthood. Many serious diseases in adulthood have their origin in adolescent period. So come to the background of the study, overweight and obesity are becoming public health problem among adolescent girls globally. Adolescent period is more crucial period when there are remarkable physiological and hormonal changes occurs in the body. Report shows that obesity is the predisposing cause for negative reproductive health, where it is associated with polycystic ovarian disease and infertility. Obesity is the one of the leading factor for cardiovascular diseases, hypertension, diabetes mellitus, and several other diseases. So transition from school to college brings many lifestyle changes in adolescent girls, including changes in dietary habits, physical inactivity, and excessive screen time. They start enjoying canteen food items where mostly beverages, bagged, fried, and fast food items are available. They tend to skip meals and fascinated to unhealthy dietary habits. Physical activity and outdoor games also not as good like in the school. All these factors put the adolescent girls at increased risk of obesity worldwide. Hence, the investigator is interested to measure the prevalence of overweight and obesity among adolescent girls in the age of 17 to 19 years who are attending colleges. So prevalent and the problem statements, prevalence of overweight and obesity among adolescent girls in selected colleges, Puducherry. The objectives of the study to measure the prevalence of overweight and obesity among adolescent girls, to associate the BMI with the selected socio-demographic variables of the adolescent girls, to associate BMI with the personal and family medical history of the adolescent girls. Come to the review of literature, prevalence and contributing factors for adolescents obesity in present era was conducted in Uttarakhand, India. Research shows that 6.8% and 71% of the adolescents were obese and overweight respectively. 53.8% had normal BMI and 22.3% were underweight. BMI was good among athletic adolescents and high among adolescents who had more than 2 hours of screen time were more obese. Cross-sectional study was conducted to measure the prevalence of overweight and obesity among 2,465 students in the age group of 10 to 18 years in 5 schools and 2 polytechnic colleges in Puducherry. The results found that overweight and obesity was 9.7% and 4.3% respectively among study participants, and no difference found in prevalence between males and the females. Come to the methodology of the study. The quantitative observational cross-sectional design was utilized for the study purpose. The Bharatdasan Government College for Women and Tagore Government Arts and Science College are the setting where the researcher conducted the study. The adolescent girls studying in the Arts and Science College was a population, and the adolescent girls studying in Bharathasan and Tagore Arts and Science College, Puducherry, were the sample. The sample size was comprised of 364 adolescent girls. Simple random sampling technique by using lottery method. 8 available courses were selected from each colleges. Study participants were screened by census method. Adolescent girls who are all willing to participate in the study in the age group of 17 to 19 years were included in the study. Those who are not willing and not available during data collection were excluded. The instruments and tools used for the study. The tool consists of 3 sections. Section 1, it consists of demographic characteristics of the adolescent girls, such as age, discipline, age at menarche, religion, dietary pattern, monthly family income, and the residence. Section B is about the personal, medical, and family health history of diabetes mellitus and polycystic ovary syndrome. The section C is anthropometric variables, height and weight, and based on this, the BMI was calculated. The high weight was measured by using Omron weighing machine, and the height scale for the height. The BMI classification was followed by the WHO scale. The BMI and nutritional status below 18.5 underweight, 18.5 to 24.9 normal weight, above 25 is overweight, and obesity classification 1, 2, and 3 is based on WHO scale. The data collection method, data was collected from November 2021 to December 2021. Total undergraduate courses available in 2 colleges were shortlisted, and 4 courses from each college were randomly selected by using lottery method. Informed consent was obtained from the study participant who meets the inclusion criteria. Structured interview question was used to collect data and demographic variable and personal health and family health history of diabetes and polycystic ovary syndrome. Anthropometric variables were measured by Omron weighing machine and height scale, and BMI was calculated based on WHO scale. The researchers spent 10 to 15 minutes for each study participant. The ethical consideration were made in the study. The formal permission was obtained from Institutional Ethical Committee, Vinayak Commission, Annapurna College of Nursing, Salem, and then Directorate of Technical and Higher Education, Puducherry, principal of both the colleges, Puducherry, and written informed consent was obtained from the study participants before data collection. Come to the result point of the study. The demographic variable, that is frequency and percentage distribution of adolescent girls according to the socio-demographic variable, shows that highest 45.9% of adolescent girls in the age group of 18, 57.1 attained their menarche at 12 to 13 years of age. 49.7% of the people belongs to science background. 89.8% were non-vegetarian. 94.5 belongs to Hindu religion. 41.4 has a family income of rupees 5,000 to 10,000. 61.3% of people belongs to joint family, and then 61.8 people are living in an urban area. Come to the adolescent girls, that is a personal medical problem. The bar diagram shows that the percentage-wise distribution of adolescent girls, that is 90.7% of the people were not having any problem in the personal medical history. Only 9.3% has the problem. And come to the family history of diabetes mellitus, 38.50% of them are having a family history of diabetes. 12.6% of the people are having family history of polycystic ovary syndrome. These 2 diseases were associated since it is relevant to the obesity and overweight among adolescent girls. This bar diagram shows that percentage-wise distribution of adolescent girls according to their personal medical problem. So those who are having the personal medical problem, in that the distribution shows that 20% of them are having PCOD, 17.6% of them having irregular menstruation, 11.8 had thyroid problem, 35.3 had wheezing and asthma, 14.7% had gastric ulcer. This distribution shows that how many had a personal medical history, that is the 9.30% of people had a personal medical history. Out of them, how the disease pattern is distributed among the adolescent girls. The table 3 shows the mean and standard deviation of weight, height, and BMI. The mean weight was 53.87 plus or minus 11.9. The mean height in meter is 2.01 plus or minus 0.05. The mean BMI was 21.8 plus or minus 4.6. The bar diagram shows the percentage-wise distribution of adolescent girls according to their BMI. The highest percentage, that is 48.40% of the people had normal weight, whereas 5.50% had obesity, 16.7% of them have overweight, 29.40% had underweight. So the overweight and obesity is 16.7% and 5.5% respectively. The association with the BMI and social demographic variables shows that all the demographic variables were associated with BMI at 0.01. So highly significant. It was being proved in the study. Come to the association between BMI with the personal, medical, and family health history of the girls. Here also the BMI was associated with the medical history at 0.05%. All three are associated. It was significant. So come to the discussion point. So the demographic shows that 45.9 of them were 18 years old, 57.1% attained menarche at the age of 12 to 13 years, 15.3% of them were from arts background, 89.8% of were non-vegetarian, 94.5 of them were Hindus, 41.4% had monthly income of rupees 5,000 to 10,000, 61.3% of them belongs to joint family, 61.8% of them from urban area. Health history depicts that 9.3% had personal health problem, 38.5% and 12.6% of them had family history of diabetes and PCOS respectively. Anthropometric variable shows that mean weight was 53.87 plus or minus 11.9, height 2.01 plus or minus 0.05, and BMI is 21.8 plus or minus 4.6. So the BMI shows that 5.5%, 16.7%, 29.4%, and 48.4% they were obese, overweight, underweight, and normal respectively. So statistically significant association found between BMI and all the socio-demographic variables at P level is 0.01, highly significant, and also between BMI and personal, medical, and family health history of the adolescent girls at P less than 0.05, significant. The implications of the current study, the community health nurse plays a major role in the health promotion of adolescent girls. Study findings helps the nursing students to provide health education and healthy lifestyle to the adolescents to maintain ideal body weight in the schools, colleges, and community. The future researcher may focus on health risks associated with obesity among adolescent girls. So the study concludes that the prevalence of overweight and obesity was 16.7% and 5.5% respectively among adolescent girls. Lifestyle habits of current generation adolescent girls increases risk of obesity. Awareness on healthy lifestyle is prime important to halt the rate of obesity and related health problems. These are all the references. Thank you for the opportunity. Hello, sir.
So when you conducted your studies, your
Hello, sir.
PG dissertation or when you conducted this study?
Announcement.
Infinite pointer. First button. First button. Change for the pointer. No, sir, for the pointer. Change on the point.
Hello. Hello. Hello, everyone. Respected judges, principal ma'am, my dear faculty, my dear colleague, and dear students. Very pleasant good afternoon to all. I myself, Sanjay Davi, lecturer of the Government College of Nursing, Surat, is going to present a topic on the national conference, which is organized by the National Scholars Society in collaboration with the Vibrant Nursing College. Let's take a look at the slide. Please stand, sir. Title of my study is Maternal Satisfaction Regarding the Quality of Nursing Care during the labor and the delivery in the new civil hospital, Surat, and imagination toward the respectful maternity care. This is my study. Why I choose this study? Therefore, we are going to check the background and introduction. Please, next one. As you all know, respected maternity care, especially focus on the rights of the woman. They directly feel in the autonomy, dignity, respect, choices, and preferences, especially in the maternity care. There is a lots of the effort taken by the government to improve the respected maternity care. But we have a lots of the study. Still, there is some lacking. Why we are not following the respective maternity care? And we have a lot different kind of the study. And we have a lots of the finding that suggest that till now the mother cannot get the respective care. Right. That's why I would like to find out what is the situation of our civil hospital Surat. That's why I conduct this study. Next one. Please, sir. Main objective of my study is to assess the satisfaction level of the postnatal mother regarding the quality of the nursing care during the labor and the delivery room in the new civil hospital Surat. This is my objective. Please. Now, this is a brief about my methodology. I have selected the descriptive cross-sectional survey approach. Study setting is the PNC ward of the new civil hospital at Surat. Study population, all the postnatal mother who are visited in the NCH. Sample is a postnatal mother and sample size is 100. Technique used for the research is the simple random sampling. Please next, sir. How I choose, how I calculate the sample size. Therefore, I have choose the reference from the Indian Journal of the Public Health, which has published the one study, especially the assessment of the respective maternity care during the childbirth experience among the mother in the Manipur. This study is conducted by the Rajkumari. And there is a hypothetical prevalence rate. This study indicates that there is a 96.4% mother didn't get the respective maternity care. Only 4% mother get the respective care. That's why I have selected the hypothetical frequency, that is the 4%. And I selected this sample size. The software is available OpenAPI, which is online available, and it is a free of cost. I have entered my data, and my population is at 10,000 because the approximately delivery conducted in the civil hospital is around 9,000 to 10,000. After the entering the all the data, my final sample size is 100. These are the references. Please next one. Now please click on this one. No. Back. Click on. Yeah, double click. Okay, no problem. In this attachment, there is a conceptual framework, description of the tool, and ethical permission that I received from the Nursing College Surat, and especially the conceptual framework. Okay, I used a general system model, which is given by the Ludwings in the 1968. There is three criteria: input, output, and process. In input, I have selected the socio-demographical variables from the PNC mother, like age, sex, marital status. In the process, I have prepared a 5-star rating scale and evaluate the mother. And as an outcome, what is the feedback, the responses that I get from the PNC mother? Second one, about the ethical permission, already I told you, I received the permission from the Government College of the Nursing. Next one. Now, there is some major finding of my study. Okay. Actually, I think there is a problem. Slide is not opening. I want to go to about the description of the tool. Okay, there is a 2 section in my tool. Section 1 is a socio-demographical variables, and second one is a the tool that include the 5-scale rating scale of the PRI regarding the respective maternity care. There is a total 20 statement. Okay, each statement has a 5 component: dimension 1, dimension 2, dimension 3, dimension 4, dimension 5, and dimension 6. Dimension 1 considered as a general respect. Dimension 2 is a abuse-free care. Dimension 3 is a timely care. Dimension 4 is a the mother is receiving discrimination or not. And dimension 5 is a overall general care. Right? There is a total 6 dimension. As per my dimension, there are some final findings of my study. After calculating the data, I have found that the 90% mother of the postnatal ward will agree that he would receive the respective maternity care, and only 10% disagree. But as per my opinion, I think this data may be wrong, क्योंकि जो मदर बोलती है वो शायद सच्चा हमारे पास रिस्पॉन्स नहीं होगा, क्योंकि वो क्या है, पोस्टनेटल वार्ड से डायरेक्ट बात कर रही है, तो किसी के बारे में शायद वो बताना भी नहीं चाहती है, इसलिए देयर में भी डेटा. Right, next one. Now these are the all 6 dimension result. Let's look at the slide. Now dimension 1 that I already mentioned you, that is a friendly care. In that 90% mother agree that she received the RMC, and rest of the 10% didn't receive. Same as in the dimension 2, abuse-free care. 98% mother agree. Rest of the 2% didn't agree. Dimension 3, in the timely care, 89% of mother agreed. Rest of the 11% didn't agree. Now, this is the good data, discrimination free. Total all the mother agree. They didn't experience, they did experience RMC. इसमें कोई ऐसा डेटा नहीं है, सभी ने बोला कि भाई हमको बरोबर RMC मिला है. एक्चुअली डेटा क्या है, डिफरेंट हो सकता है, जो हमने देखा है हमको मालूम है, राइट, लेकिन सभी के सामने क्या है वो शायद बोल नहीं सकते हैं. Now, dimension 5 is privacy maintained. 89% PNC mother agreed they received the RMC. Rest of the 11% didn't agree. Now, last one, dimension 6 is the care of the baby. 84% mother experienced the RMC regarding this one, and 60% didn't. Overall, there is a 90% mother agreed that they received RMC in the civil hospital Surat. Rest of the 10% didn't agree. Right. Next one. Please, ma'am, next. Now, this is the graphical representation. Next one. We have already discussed this measure finding of the study. Okay. Next one. These are the references which I used. Next. Next. That's all about my presentation, my study. Thank you very much, sir. Thank you.
Sir, can you explain about your tools which you have prepared for your study?
I actually already mentioned here. You can see from in my book. Why it is not opening?
No. Can you explain? File is not supporting, but can you explain about your tools which you have prepared to collect the data from the patient?
I am making a 5 rating scale. Okay. Strongly.
It is your own or it is modified or it is standard?
Modified respective maternity care guideline and module, which is available on the WHO website.
So how many points you consider in that 2 point or 5 point?
5 points. 5 points rating, sir.
Study area is very good, no doubt. But I have a few questions to ask from you. How you have defined your respectful care and what is your definition in your study discrimination? That is very important. Okay. And you said you have taken mothers only from postnatal mother. But if you've seen studies and Government of India guidelines and what my experience, I have been an evaluator of RCH program. Labor room is the most critical area where mothers face issues and where respectful care is not given. Why you have not taken labor room? And for how many postnatal mothers hardly stay in the hospital for 1 or 2 days? What was the attrition rate in your study of your postnatal mothers? Then you said mothers were not able to, they had the favorable reply towards the care. First of all, you are doing a PhD study and you have used only one tool. Why not the triangulation and your own observation is there? Because you could have gone to postnatal ward and the labor room and do the observation yourself. Then you can interview the mothers. Then you can even interview the relatives. Then you can do the triangulation of the data. And then you justify your discussion with the previous studies. Otherwise, PhD study level study is only for postnatal mothers. I don't know what is the, your output will be useful or not in this way. These things, these were some of my observations. And because you should have used the mixed method study. You have only used one checklist. Your qualitative data is nowhere. Because qualitative data will strengthen your study if you have the qualitative data and with the themes, so that you can come out actually why this mother feel that they face discrimination. Those themes will come out, then only you can recommend the implications and recommendations. These are some of my observations.
Thank you very much, ma'am.
Only at the PhD level, only you create one objectives.
Actually, sir, I think there is some misunderstanding. This is not my PhD level study. I never said this is my PhD level study. It's a difference. This is my study from the research methodology. Yeah.
One point which I forget, you are working in the same hospital and you have taken only your hospital, and there will be a conflict of interest and biasness in your observation and the findings. You have to declare, that is the basic principle of any research methodology, to declare the conflict of interest.
Definitely, madam.
If it is not even of PhD level, then also your methodology is very weak.
I agree, ma'am. Right.
1 minute, sir.
Sir, in your first slide, I saw you that you mentioned you are a PhD scholar.
Ma'am. That's why I mentioned that.
Yeah, that's
That's
a,
different study.
okay. You are pursuing PhD, and
Yeah.
this is your different topic, right?
Yeah, ma'am. This is study from my Veer Narmad Gujarat University. I am doing my research methodology. Already I have completed.
Okay. So you don't mention the hypothesis in your study.
Actually, madam, hypothesis is generally, I think it is not necessary in every study. This is my assumption.
Okay.
Not in every, if it is descriptive only, because
Yeah, yeah.
hypothesis
Sorry,
always
sorry.
will be
I agree.
technical.
Definitely, sir. Definitely. Sure. Anything? Okay. Thank you very much, sir. Thank you very much, everyone. Thank you.
Next participant is Ms. Manisha Waghela, ma'am. Miss Manisha Waghela, ma'am, are you ready for your presentation?
Ma'am, slide is not sharing. It is visible. Hello. 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 Hello.
Student, please keep silence. Manisha Waghela, ma'am, are you ready?
Hello. Madam, screen is visible or not? Hello.
Manisha Waghela, ma'am, please start your presentation. Are you audible? Hello.
Hello. Hello. Hello.
Manisha ma'am, can you start the presentation?
Hello. Hello.
Yes, Manisha ma'am, I am able to hear you. Can you start the
Sir,
presentation?
Can you share
Yes.
the PPT from your side, sir, please?
It will be better. You are the host. You can share the PPT. So can you share from there?
Sir, I can't share this. That's why
You
I'm telling
cannot
you.
share. Okay, let me check it.
That's why.
Sir, आपकी दो.
Yes, Manisha ma'am, now try.
Yes, sir, I try.
ऐसे में प्रॉब्लम आ रही है तो रिकॉर्ड करके बुलवा लें अपन, वो लाइव हम देख लेंगे फिर।
मनीषा मैडम आप स्टार्ट कर सकते हैं।
Last.
Sir, I can't share the PPT. That's why I'm waiting, sir.
Okay, let me check. Okay, let me check.
If sir possible, try to from there.
Yeah, trying, madam. Let me check. No?
Yes, sir. Yes, sir. Can I start, sir?
Yes, Manisha madam. Just to start now.
Yes, ma'am. Go for the next slide, sir.
Just the slide change करो. Form करो.
Hello. Hello. Hello.
Yes, ma'am.
Can I start, sir? Hello.
You start.
Yes.
Yes,
Good
ma'am.
evening.
You start.
Start कर दो, sir. Hello. Good evening to all dignitaries, judges, and all the colleagues.
Yes, ma'am. Start.
Today is the yes, sir. Yes, sir. I am started already. Hello.
Yes, ma'am. Yes, ma'am. You can start.
So hello.
બીજું કોઈ સ્પીકર ચાલુ છે.
Hello. Hello. Can I start, sir?
Yes, you start.
Okay. Good evening to all. Today is the scientific paper presentation. Myself, Manisha Vagela, working as a assistant professor. So today is my title. Title is a comparative study to assess the knowledge and attitude regarding the advantageability of infertility among the married couple living in the selected rural versus urban area in Gandhinagar district of Gujarat state. Sir, can you change the slide, please? Hello.
We check your PPT. It's not moving.
Sir, PPT operated
okay.
from the there. Hello. Hello.
Yes, ma'am. Start. Yes, ma'am. Start. Yes, Manisha ma'am.
Hello. Can you please change the slide, please? Hello. Hello. Hello.
Hello. Hello. Hello.